and then I'll also share my screen. Okay, great. So I'll just check, can everyone still see the presentation now in full screen?
Yes.
Yes.
Great.
Yeah.
Fabulous. Okay, so today we're going to run through an introduction to Cheshire and Merseyside's contact tracing hub for complex cases and settings. We're going to talk about the organisations that have been involved in this piece of work. We'll run through the benefits. We'll also provide some context and some information around how the hub team works. And we've got some members of the hub team on the call today who will provide more context and information as well. We'll provide an overview on how we've enabled this team from the very beginning, and then we'll also run through sort of what our current priorities are with the contact tracing hub and what we're looking to in the future. So if we start off with an introduction, so I think that colleagues on the call will hopefully agree that this year in particular has shown that when managing the spread of a disease like COVID-19, effective contact tracing is really, really critical. And I think that's very much been sort of internationally recognised now. And when thinking about contact tracing, it's simply the process of identifying, assessing and managing people who've been exposed to disease to prevent onward transmission. And I think that through my involvement of this project, what's really stood out to me is the fact that contact tracing on this level really is a specialism in its own right. And it's a real fine art that takes some time to get perfect. But once you do get to that point, it can be really, really effective. So with all of this in mind, and in particular, when thinking about contact tracing or managing the spread of a disease in a complex situation where it can add a layer of complexity and is quite complicated, I think one of the things that sort of has stood out is that when it is complex, when it's complicated, it requires more intensive and local intervention and requires really boots on the ground to make sure we do a good job. So it's for that reason that the contact tracing hub for complex cases and settings has been developed and established in Cheshire and Merseyside this year. And really the purpose of this hub is to bolster local resilience and ensure a safe system happening for contact tracing, and will ensure that local intervention is happening and is quite intensive. So about the hub itself, so one thing that's really that we want to try and make clear is that the hub is a shared collaborative team that works across Cheshire and Merseyside. It's all about scaling up existing arrangements and bolstering the local system support to support those who have tested positive to keep the rate of infection down. And because it is a collaborative and it's a mixture between different agencies and partners, it is not owned or managed by any one organisation agency. It's a collective partnership of people working together and works across the entire patch of Cheshire and Merseyside. And with that in mind as well, it's also not a commissioned service, or it's also not a replacement for any national test and trace programmes. Again, it's about taking what's already there and bolstering it with local resilience. So in terms of who's involved with the contact tracing hub, what I want to do is just really show on the screen all of the logos of the partners who are involved in the setup and the facilitation of the contact tracing hub, just to really give you guys an idea of the breadth of partners that we have involved in this piece of work. So you'll see that we have all the local authorities across Cheshire and Merseyside here, and working alongside their directors of public health, working to make sure that this local intervention happens in place and is really well established. We also have support from Public Health England as well as the NHS, and you'll see also Champs Public Health Collaborative and the support team is involved in this project. But again, as you'll see, every single logo is the same size. We don't have any one organisation that has a complete control or ownership. Again, I really want to stress it's that shared collaborative, and it's all of these partners that you see right now working together as opposed to just one leading the project. It's a shared collaborative in that nature. So in terms of the benefits of the hub and why we have a contact tracing hub for complex cases and settings, there's three sort of headline benefits as to why this piece of work has been scaled up so quickly. So first of all, that sub-regional and local intelligence is really key. And I think that you'll have seen in the media, there's been some criticism with the national test and trace programme, which it's definitely getting better. But one of the main criticisms is that it's very hard for someone in a call centre in Leeds to understand a place like Cheshire and Merseyside and to understand the nuances of the different areas within it and some of the different words that people use. So what we know that particularly when we want to do some very complex and complicated contact tracing, it's better to have people who know and live in the local area and who really understand the people they're speaking to and the areas they're speaking about. A second benefit of this is efficiency. So because of the way the hub has been stepped up and the fact that it's so flexible and so agile, it means that it's also a team that can act really fast when data becomes available, and that there's no sort of very sort of weighed down processes in place that means that things can get stuck. It's a very flexible and agile team, and the reason why it's been set up in this way is because with contact tracing and outbreak management, the sooner action is taken, the better. And then finally, the third benefit of having a local contact tracing hub for complex cases and settings is the strategic vision and leadership of the directors of public health in the 9 areas of Cheshire and Merseyside. So with these directors of public health working together as one team, they can sort of share resources, share that, and again, bringing it into that idea of the shared collaborative, but then also identify those areas of concentration that need to be looked at within their place. They can look at how we can share resources and share resilience and make sure that basically things can be actioned quickly. And all of the directors have to work together to develop a collaborative outbreak management framework across Cheshire and Merseyside, which again means that it's very much local and allows for that sort of intensive work to happen in place and not from a national perspective where things might not be as slick at the minute. So we've talked about the fact that the contact tracing hub focuses mainly on complex cases and settings. I think it's worth now just running over very quickly what we mean by complex setting or case, because as the hub has developed and as it's been developed by the partners across Cheshire and Merseyside, these definitions have changed ever so slightly as things have become more set in stone and in place. But what we mean by potentially complex setting are settings like special educational needs schools, social care settings, homeless accommodation, domestic violence, refuges, residential children's homes. We could have potentially complex cohorts, so that could be rough sleepers, faith communities, asylum seekers. It could be sort of also potentially complex individuals and households. So that could be where there are issues with safeguarding, where the individual is clinically shielded. There might be learning disabilities, mental illness, substance misusers, and could also be things like multi-generational households where it's just not simple and requires a little bit more intensive intervention from the contact tracing hub. And then finally, there are potentially complex workplaces, and I think the one that's really stood out at the minute, particularly from a media point of view, are sort of food production plants and warehouses where that infection can spread very easily and very quickly, and again requires a team sort of boots on the ground who know the area and can get in there really, really quickly and try and limit that spread as much as possible and do some really effective contact tracing. So if we talk about now the hub team that we have, so again, this as it's a shared collaborative and as it's a shared sort of service across all of the partners across Cheshire and Merseyside, it's sometimes hard to sort of visualize what the team actually looks like because they're not really all sitting in an office somewhere where they're very visible. So I thought it was worthwhile just sort of showing on the screen now the breadth of what we currently have. So we have 4 team leaders, 4 call handlers, 26 contact tracers. We have 4 members who are providing business support. We also have some analysts that are outsourced from the CSU, and all of these colleagues work together 7 days a week, 9 a.m. to 5 p.m. to provide a full cover for contact tracing for complex cases and settings. And again, as part of my involvement in this project, one thing that's really stood out to me is the diversity of people within the team and colleagues within the team. We have, people who have been IT consultants or qualitative researchers, and what we have is a real breadth of knowledge and experience that all adds and enables that contact tracing to happen, and means that we've got a very, very strong team of committed people who have very, very quickly adapted to a situation where they now have to do some very intensive investigations and research. But the way it's set up is that they also can act really flexibly as well. So I think this team will definitely grow as more is required of contact tracing, because we know that COVID's just not going to magically disappear. But this is where we've gotten to at the minute, based over the last few months. And at the minute, as I say, we're working 7 days a week, 9 a.m. to 5 p.m. So if we talk now about how the hub team actually works. So the main way that cases or settings enter into the hub or are made aware of by the hub are either from the National Test and Trace Service, which is more of a sort of, it's national, or it's from local areas, so local authorities or other local contacts relating to a positive case of COVID-19. And really it needs to meet that criteria of that it's complex in regard to the individual or the setting. If it is not complex and it does not meet that criteria, it goes to another part of the system. But if it does meet that criteria, the cases are then triaged by Public Health England and then assigned to the hub. And I'm sure some of the colleagues on the call today will talk through what that means whenever it's assigned to the hub. And really, all of this happens really, really quickly. Again, I think a really key feature of the contact tracing hub is that things happen very quickly. It's very agile because really time is so precious and so important in this situation where an outbreak or a spread of an infection can get out of control very, very quickly. So when talking about enabling the hub team, first of all, we have the contact tracing mobilisation team. So this is a group of people who came together in June, and really their task and the purpose of that team was to quickly stand up the hub and get it functioning as soon as possible. This team included stakeholders from Public Health England, local authorities and the CHAMP support team. And I think one of the big achievements, and Helen Cartwright, who's on the call, I'm sure has this as one of her big achievements, is that we got this hub stood up and functioning in 6 weeks, which required a tremendous amount of work, but allowed the team to sort of come together and do some really great work very quickly and definitely make an impact on the spread of the virus in local communities. So what we have now, as we sort of are a bit more formalised as a team and the hub is a little bit more established, we have a contact tracing strategic programme board. So this is a board that's been recently established and it meets monthly. And basically the purpose of this board is to provide strategic leadership and oversight for all elements of contact tracing in Cheshire and Merseyside. So it's currently co-chaired by both Julie Webster, who is the Director of Public Health for Wirral, and Sam Gebrehewit, who is the Head of Health Protection for Public Health England North West. And right now, the purpose of this strategic programme board is to focus on developing the contact tracing hub for complex cases and settings. But in future, and maybe potentially in the near future, this remit will extend beyond the hub and will also aim to support local teams as well as provide assurance to the Directors of Public Health around all elements of contact tracing locally. So if we think now about some of the key priorities that the contact tracing hub is currently focusing on and will be looking to in the future, there's sort of 6 key priorities I've outlined here. So the first is around evaluation. So that's working with colleagues to establish an evaluation framework that will take account of a range of perspectives. We have one definitely sort of key priority is coordination and local integration. So we're exploring the possibility of 2 coordinator roles, one for Liverpool City region and one for Cheshire and Warrington. And really they'll be there to try and provide that coordination and try and stitch together the local areas a little bit more to make sure that we are able to sort of coordinate things accordingly and sort of provide assurance and sort of share the load and things like that. Another really important element of developing the contact tracing hub is how we manage data and how we can do that better. So we currently have a data management system sort of in place at the minute, but we are implementing a new content management system from Microsoft Dynamics, and we'll be sort of that will be happening over the coming weeks and months, and we'll be feeding back the progress on that with you guys in the new year. Training, I think, particularly for the hub team, I think it's really important that they have top-notch training and they're able to access that training so they can deliver that really high quality contact tracing. So at the minute they receive training from Public Health England and they have support from the consultants, and there's different opportunities we're exploring to make sure that we have our contact tracers and our hub team really well trained. Development and innovation. So this is something that definitely is going to come into the fore in the new year, which is working collaboratively with partners across Cheshire and Merseyside and nationally to develop an integrated approach to contact tracing across Cheshire and Merseyside, because we obviously have the hub as a complex cases and settings concentration that shows that local approach to contact tracing really works, and we're now exploring how that can be branched out on in the new year. And then finally, I think a really important priority is stakeholder engagement and keeping our partners up to date with stakeholder briefs, which you'll be receiving regularly, and engagement sessions, just like the one you're in right now, which has all been underpinned by a comms and engagement plan, because we know that we cannot rely on people just to find out naturally about this really great work. We have to try very hard to engage with our stakeholders as well, so they know exactly what the contact tracing hub is and isn't and how it works. So finally, last slide from me is just around how to contact the hub team. So if you want to find out a little bit more about how it's been set up or how it functions itself, the best protocol is to speak to the CHAMP support team, or we also have a phone number for you to refer cases directly to the contact tracing hub if it meets the criteria of a complex case or setting. And we will soon also in the new year have an email address that will be live as well. So that actually is all from me. I'm very proud because I've managed to just stick within the 15 minutes that I've been allotted. So I can appreciate I really flew through that. And I will say as well that we also have a recorded version of this presentation that runs through in a little bit more detail a hub flow diagram of how cases work, how cases enter the hub, and what the processes are whenever they do enter the hub. So we'll also circulate a link to that as well. But hopefully that's given you a bit of a quick fire introduction to the contact tracing hub for complex cases and settings. And now I'll hand over to Rita, who will provide some more local examples and provide some context of how this works in practice.
Thank you. Thanks, Ryan. Hi, everybody. So I'm joined by three of my colleagues today, Kevin, Melissa and Lucy. And I was just thinking about what you were saying there, Ryan, because even between the four of us, we've come from 4 different professional backgrounds. We've got dentistry, pharmacy, environmental health, nursing. We've never worked together before July, and we've never actually been in the same room as each other. So, but to think how quickly we've set up a team and we've had to cope with a lot of IT challenges. So it's been quite a journey, and there's still a long way to go because there's still a lot of things, as you've already said, around better integrated working and system-wide working that we need to take forward. But we've come a long way so far. So I'm going to start first of all by just asking Kevin just to say a few words about his role as a team leader, and then we're just going to talk through a few case studies just to give you an example of the work we do. So Kevin, are you okay to come in here and just sort of talk a little bit about your journey as a team leader?
Sure, yeah, absolutely. Quick whistle stop. So I'm a pharmacist originally by profession. I qualified in the mid-90s, spent most of my career working in the private sector, really as a NHS provider, providing pharmaceutical services. Ended up, for my sins, becoming superintendent pharmacist and chief pharmacist for some organizations, did some startup work and some collaboration with some GPs. Ended up making myself redundant by selling the businesses and had a bit of a career break because I thought I wanted to do something a bit different. I had my career break, and then straight as soon as that finished, COVID came. And so here I am having my change of career that I sort of thought I might want. So I did some work for NHS 111 on COVID response, and did some work on the national test and trace tier 2 system. So the contact tracers who call every case pretty much in England, who test positive and help trace their contacts. Did that for a period of time, and then was asked to come into the local team. Obviously use my local knowledge. I've lived and worked around Cheshire and Merseyside for most of my career, and so know a fair bit of the geography and what's going on. And then from there, there was the opportunity to become a team leader and use some of my previous management and organizational skills and bring them to the hub, really. So for my sins, I'm also the clinical lead for the case management system for Dynamics. So you can shout at me later. And yeah, and on a day-to-day basis, really about managing the day-to-day workload of the hub, prioritizing the caseload, so we can make sure that we deal with the most vulnerable and highest risk settings first, both in terms of the people involved, but also in terms of the situation and its potential for spread, and that spread then going into the local communities as well. Helping the contact tracers really with their day-to-day work and giving them advice. You'll be aware that the amount of guidance and the rules around COVID are immense. So really, just helping to work our way through those and communicate that to the different settings, and making sure we provide really the right level of advice and really supporting settings to be able to manage their workplace or their setting from a COVID point of view better in the future. Is that all right, Rita? Does that give you enough?
That's great. Thank you,
Okay.
Kevin. Right, I'm just going to attempt to share my screen. That's great. Could everyone see my screen?
Yeah.
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 Lovely. Okay, so we're just going to talk through a couple of scenarios. Lucy's going to talk through the first one, and then Melissa will come in and I'll just talk through the last one. So hopefully we should be within time. Lucy, are you okay to start on this case study?
Yes, of course. Yeah. Hi. So one of the cases dealt with recently was a meat processing plant with approximately 85 staff and including 26 agency staff. So the setting was a large sort of production and butchery area with a loading bay and then 4 offices. So over the case of dealing with this case study, we had 22 confirmed cases over quite a short period. So it was over a 7-day period, which did include a weekend, which I think helped keep the spread reduced. So of those 22 cases, 8 were asymptomatic. The plant works 5 days out of 7. 18 of the positive cases were all from the production area and all on one of the lines. So in the large production area, there's 3 lines. 2 have got 20 staff on each and 1 has 8 staff on it. And it was 18 of the 20 off one line. So, obviously we looked into that in some detail. And on that line, the staff, due to the nature of the job, were having to work side by side, not maintaining 2 meters social distance. It wasn't possible to achieve the task, and they were wearing full PPE and working in a bubble. 3 of the other cases were in the loading bay area, and we had just 1 case in the offices. And the company, over the course of the investigation and the support, was very proactive regarding the controls and had already started, looking at their contact tracing. But what we needed to do was advise further on the contact definitions and the more sort of detail of the contact tracing, and supported that with quite a bit of time spent with them, and also reviewing their COVID-19 procedures right from when staff were arriving at the gates through their working day, including breaks and toilets and lockers and handover meetings, etc. One thing that they had started doing really as we got involved was sourcing some testing, and they were doing just about to start rapid antigen testing. So it was quite a discussion there because they were going to be just testing everybody. So obviously we needed to make sure they weren't testing those cases that had previously tested positive when they returned to work. So we gave advice about that. We made sure that the setting informed the Food Standards Agency. And we provided after ongoing follow-up, weekly follow-up and support. So if you can go on to the next slide, Rita. And then, so opportunities and challenges. We were able to provide a lot of information to the setting, contact letters, warn and inform letters, and links to many sources of guidance. Through the review, which is a thorough review of their procedures on site, we're able to provide a bit further sort of clarity and a bit more recommendations about where further action was needed to be considered in this case, for example, they hadn't looked at usage capacities in toilets, so we were able to sort of, make sure that was reviewed. On the site, language was quite a challenge. There was a large number of employees that spoke quite little English, so communication for the setting to the employees was a challenge, and getting the right message across. It very quickly came to light through the contact tracing. There was a lot of evidence of car sharing between the groups. And a lot of social and household exposure was identified, because possibly, with not understanding of the messages, there were staff attending work, even though they had children who were positive and isolating at home. So there was quite a job to do there, really, with getting the information through to all the staff. The outbreak was very quickly controlled, actually. That the business was very proactive. The weekly follow-up calls haven't identified any further cases, and now all staff are still being tested weekly and aren't allowed on site until they got the results through from the rapid test. Obviously, multi-agency working, is really key. So we've had, really good contact with the EHO. IMT was convened by the local authority, and we made sure that the FSA were involved and identified about the outbreak. Okay.
Thank you, Lucy. Melissa, I know we had a very similar situation, didn't we, in a commercial bakery? There was some similar themes coming through: car sharing, household and social transmission, and a large number of employees from overseas. Is there anything you want to add to what Lucy's already covered in her example?
Yeah, it was very, very similar. Large food manufacturing setting, over 360 staff. The only additional we had to sort of provide to this setting was around the extended 5-day isolation period, when a case doesn't actually get their test until 5 days after onset of symptoms. But everything else was pretty similar to what Lucy said, yeah.
Okay, thank you, Melissa. It's just because we're short of time, that's why we couldn't go through that situation. And I'll just end with this one. I mean, it'll be one that a lot of you will be familiar with. If I just call it a car manufacturing plant in the area, employs over 2,500 staff and subcontractors. So we've been on quite a long journey with this setting. So it's one of the first settings we ever dealt with when we were a newly established hub. So back in July, we were getting trickles of cases, 1 or 2 a week, coming through CTAS, and we were supporting the setting with contact tracing case by case. In August, the site had a shutdown, a lot of staff went on holiday, and we saw a sudden increase in the cases to about 8 or more a week. And the approach we were taking just didn't work anymore, because it was just a whole sort of situation of them calling us and we missed their call, and then we called them and they missed our call. So we decided to take a new approach with this site. And we worked with them quite intensively at the beginning to help them to undertake their own contact tracing, and to then learn how to recognise clusters, hotspots and trends from their contact tracing. And we arranged weekly meetings with them until we felt they'd got their processes well established. Opportunities and challenges. Well, opportunities with working with this site. Obviously now they're self-reliant in terms of contact tracing, and they are aware that it's not just a case of tracing each case for the sake of it. It's actually, the purpose of it is to improve practice and to identify outbreaks early on. So we've enabled them to think about, if they're seeing local hotspots and clusters, look at practices in that part of the production. How can they improve practices, and how can they prevent further cases and, stop any outbreaks developing? Some of the challenges we face with this setting, it took us a while to find out who the right people are to speak to, but eventually we did establish some very good links. Getting timely data, that was very difficult until we got the right contacts in place. We got a lot of conflicting information from different people that we spoke to. And as we've maintained contact with them over time, we've had lots of sort of technical questions from them about false positives and global travel, because a lot of their staff are travelling around the world and through different travel corridors. So usually a week doesn't go by where I haven't had an email from them, but we're very happy to carry on supporting them. There was a lot of multi-agency working with this site as well. We involved the local authority very early on, and I know the EHO has visited the site several times, which has been really helpful. We've also liaised with the national PHE team several times about some of the questions that they raised with us that we were not able to resolve. And as I say, we're still in contact, and fingers crossed, things seem to be under control at the site. So I think it's been quite a positive experience, but a steep learning curve for us because it was one of the very first complex settings that we dealt with. So that's all from us. I hope we kept to time, and we'll be able to go and take some questions now.
Yes, it looks very much as though we're bang on schedule pretty much. I think 3 minutes difference, but then I went 3 minutes over in the introductions, I think. So thank you very much. So if we can move on to questions, I can see that some hands are up. Whoops, I've just put my own hand up rather than looking at what hands have been raised. So if I can go to Irfan first.
Thanks, Matt. Thank you so much for the presentation. It's really helpful. I just wanted to check a few things. What about the data flow? So how do we get information on our cases, which has been dealt by the hub, and how frequently the data is coming to us? And also at the same time, do we know do we have the data on the number of referrals which are made by our local authority to the hub? Thanks.
Do you want me to take that, Matt?
Absolutely.
Yeah.
Thank you.
Yeah. So this is an area that we are working on at the moment. So at the moment, we routinely let the local authorities know about any cases that we are concerned about and we think need to be escalated to the local authority and require local authority input, or anything that's specifically unusual that we think you would want to know about. So we don't routinely inform the local authority of every case that we're dealing with in the hub, but we're recognising that both ourselves and the local authorities not knowing which settings each other is dealing with is starting to become more and more of an issue. So we've started to have some early discussions. We had a meeting this week to look about how we can start routinely exchanging data both ways, so we know what yourselves are dealing with and you know what we're dealing with, but trying to do it in a way across 9 local authorities that doesn't become, the huge task in itself, and how to make that information timely. So it's a work in progress, but any suggestions as well, how we could do that would be really helpful.
Thanks, Ethan. I think that would be really important so that we avoid any duplication of work. Our colleagues, our EHO colleagues might start dealing with that because we are looking at line listing. We also get information from local enhanced contact tracing, and that's kind of daily looked at in our morning meetings. So it's just so we avoid that duplication of work. So.
Yeah, absolutely. And I think there is obviously duplication at the moment, but we need to look at how we can improve that.
Matt, can I just come in on that?
I was about to ask you if your hand was related to this.
So for colleagues, and I'm not sure who attended the workshop on the 7th of December. So that was really around developing an integrated system for contact tracing across Cheshire, Merseyside. And a clear, we've been on a journey, we'll continue to be on a journey with this, which Reece had mentioned, but and one of the key priorities, I guess, is how do we ensure that we've got that stronger working relationship between local and the hub? And that's going to take a bit of time across complex systems, but it is up there in terms of the number 1 key priorities, looking at roles and responsibilities at hub and at local. And Rita, I can't remember if you mentioned the 2 coordinator roles that will have sort of a role around contact tracing, but an outward facing, sorry, Ryan, it was yourself in the presentation, an outward facing in terms of into the local system to bridge that gap. So We're on a journey. We're not going to solve it overnight, and we need to collectively come up with a solution that works for everyone. Thanks, Matt.
Thanks, Helen. And like locally, because I work in West Midlands mainly, we get a daily report. Because we don't have a hub. We have Public Health England and we have local authorities, so it's a different system. But on a daily basis, we do get that outbreak situations report, which is not now on Power BI as well, and that's quite really helpful to do that. And then on a weekly basis, we meet up with our kind of lead person in Public Health England and go through all those situations and so on. And we have found that really, really helpful just to have that kind of an hour's meeting every week and just go through those cases quickly and making sure that if there's any outstanding actions, we can resolve that and discuss that. Thanks.
That's a useful suggestion, Sue. Thanks, Stefan.
Thank you very much. In which case, unless there's anything else on that question, can I move us on to Lucy?
Hi everyone. I've put a question in the chat box. Just with regard to the examples that you were giving, Rita, with the meat factory, we did a lot of work internally on that, and I'm glad that we did do a lot of work internally on that because we had control of it, we knew the information, etc. But I just don't understand, based on what you just said, what the difference is between what we were doing and what you were doing, and if we had any kind of collaboration or sharing of information. I'm just struggling to understand the difference.
No, we did, yeah. We had an IMT, we had the HOs involved, so we dealt with the sort of initial contact tracing and some of the technical difficulties, that some of the questions that were coming in around the categories and the testing they were doing, and then asked for EHO input, you know, sort of more on the ground to look at their COVID safe working practices. So once EHOs had got involved, we stepped back from that point of view and just maintained weekly contact with the setting just around the case numbers to see whether everything seemed to be coming under control. So I think once you were more involved, we stepped back gradually.
Okay, that's good to know. But just in it'd just be good, I don't know, just what we do versus what you do kind of thing. I just to really understand and make it clear to the programme team, just the difference, and then just key from me is that the data that I know you're working on, that's the key, that's kind of the key thing that I want to know. So I absolutely understand what you say that you're doing, and that's great, but just more the statistics around our area, that's really what I'm looking for from the hub.
Yeah, I think it's a tube. I think because we need that from yourselves as well.
Yeah, we've just been asked to give that, and we've set up processes internally that we're going to be giving you that every week. So we've changed our spreadsheet, so that's quite easy for us to do. So we will be sending you every Friday afternoon information that you're looking for on our cases. So hopefully, if we can get that in return, that would be great.
Yeah, we're just working on that now. It's just we've just got to look at how we pull it off our systems and break it down by local authority. But I think in the next couple of weeks, we should be able to get something sorted.
Fab.
Thank you very much. I can't see any other hands up. Are there any other questions? Oh, a hand has just gone up. Irfan, is that a new hand or is that your previous hand?
It's a new hand. I just wanted to just check for referral. Is it as simple as just picking up the phone and speaking to a colleague, or is there like a kind of a form or a template which we will need to fill and send it over to you?
The phone is the best. Yeah, that phone number that Ryan put up in the slides, that's the best way to get through to us.
Thanks, Rita. I think it's probably we internally need to decide how we are going to use that. Probably the morning meetings, the other meetings will be where we decide which cases could probably go to the hub rather than that internally. And I saw that you have put special schools, but not the other schools. So like if there's a huge significant outbreaks, you don't deal with those schools. Just a
Yeah, so it's been agreed locally. Routinely, we don't deal with mainstream schools, but any local authority, if you're dealing with a large outbreak or complex outbreak in any setting, can always ask for PHE support. So that, that always stands. But routinely, we don't follow up mainstream schools.
Thanks. And when you say PHE support, so we will go directly to PHE, or will we come to the hub first?
It doesn't matter which way, because we work closely between the hub and the health protection team. So you could either contact the health protection team on the main number or come through to us in the hub, and we'll just refer stuff between us as needed.
Thank you.
Thanks very much. So are there any further questions? Martin.
Yeah, it's just just clarifying a little bit. Lucy R. And I know this was an original sort of reach out from yourself, wasn't it, Lucy, in terms of wanting to build those connections and understand a little bit more about the hub. Has the session this afternoon and the discussion, has it helped towards that, out with the points that you're raising of needing to understand more on the data side and so on? But was this what you were looking for? Is it what you were expecting?
It's useful, but it's a repeat of information I kind of already knew. I'm just more looking for that data and actually what you're working on in my area and understanding really the difference between what we're doing and what you're doing. But I think, as Rita said, if that's coming in the next few weeks, then that's probably the point at which you'll be giving me more of what I'm looking for. But I mean, it's good. I know more than anyone setting up these things at such short notice, and all the processes and systems and people. It's absolutely chaotic, isn't it, at the minute? So absolutely appreciate it. But I think if we can get ourselves in a good position and sharing data in the new year, that'll be really good going forward. And I think Martin, we've kind of got a really good internal training program worked up now. We've done quite our own comprehensive training. So I don't necessarily think we need as much support in that area, but maybe a session to share our learning and what we're doing with yourselves might be useful in the new year.
That sounds good. Yeah, thanks.
Thank you, Martin. Is there anything else anybody wants to ask at this point? Irfan.
Yeah, thanks. I think it would be quite useful if we can have these regular kind of engagement sessions as we're going to in future. So then, if there's any updates, any highlights, and if there's any issues, we can discuss them. I know you are dealing with 9 different local authorities, so whether it's across all the 9 local authorities or it's some on a different basis, but I think having a regular kind of catch-ups engagement will be quite helpful.
Does anybody want to come back on that, or are there any plans towards that sort of engagement, or does this again link back to the conversation about information sharing on a more regular basis that we between us across the patch are looking at developing?
From my point of view, I think certainly the latter, Matt, in terms of getting those processes of information sharing, get those up and running, and certainly looking at creative ways as best as we can, acknowledging the 9 local authorities that there are, but looking where we can to actually sort of keep these opportunities of engagement, keep them sort of moving forward, really.
Thank you. Fine. Again, unless there are any other questions, then I'm happy. Would anybody from the hub side like to offer any reflections on any further reflections on the session this afternoon? If not, then we can move towards bringing this to a close.
I just want to thank everyone for organising it, and it's been an opportunity for us to discuss things together. And I think we've all identified that the sharing of data is the key issue, so we can focus on resolving that in the immediate couple of weeks coming.
And I just echo that. I think, you know, thank you to everyone, you know, because we're working collectively on this together. You know, we can't have, there's no one bit of the system that owns it. It's a collective ownership. And we need to have a very solution focused approach that we all buy into. So, you know, thank you for the time this afternoon, to the hub, and to yourselves, Matt, and the team locally. And if, you know, any further questions, any suggestions, and then feed them through, for sure.
And then just quickly for me, just to say that after the session today, I'll send around the recording of this session alongside a recording of my presentation from the beginning, which is a slightly longer format. And I'll also send around a stakeholder brief, some slides, just lots of information for you guys sort of to sort of brief yourselves and to brief colleagues as well. So I'll pop that in an email, and please do share far and wide as you see appropriate. And any questions at all, please do not hesitate to get back to us at the support team.
Brilliant. Okay, thank you very much. So I think we've got a few clear actions, particularly around the data. I think this has been a really, really useful opportunity to touch base and catch up on the activity that the hub's been undertaking, and to understand in a bit more detail what the linkages need to be to really make sure that we've got the information flowing in both directions between the local authority and the hub, so that we can get this collaborative approach as strong as it can be, especially as we move into the new year. So thank you very much, everybody, for your time this afternoon. I think this has been a really useful session, and I look forward to seeing how this continues to develop over the next few weeks and months. So that I think gives you about 5 minutes back ahead of what no doubt will be your next meeting. So enjoy that on a Friday afternoon, and I look forward to speaking to you all again soon.
Thank you, Matt.
Thanks. All the best, Matt.
Bye.
Thanks very much.
Bye.